Hey there, viewers. In 2018, 1 in every 6 deaths from cardiovascular disease was due to a stroke. In the US alone, someone has a stroke every 40 seconds. Believe it or not, you can suffer from a stroke and not even realize it. It's called a silent stroke. While silent strokes have no easy to recognize symptoms, they can still cause brain damage. A study from 2003 showed that a third of people over the age of 70 will suffer at least one silent stroke. Let's talk about how to treat a stroke you didn't even know happened. What can you do to prevent silent strokes from happening? How quickly should you get a doctor? How important are brain scans? We're talking all that and more. Number 1, you have to get a brain scan first. This is one of the scarier facts about a silent stroke. Because the symptoms are so subtle, you probably won't even realize you had one until it shows up on a brain scan. This is why it's so important to get a doctor ASAP. The damage done to your brain will likely show up on a scanner. With a CT scan or MRI, the image will show white spots and lesions in the places of the brain that have stopped functioning. From here, the doctors are able to diagnose it as a silent stroke. So, when do you get a doctor? I mean, sure, it's always great to be on the safe side, but you obviously can't just walk in for a brain scan every couple days. There's plenty of symptoms to look out for. The common stroke symptoms include dizziness, headaches, memory loss, poor balance, speech issues, and extreme fatigue. With a silent stroke, you'll experience many of these. Facial drooping is more associated with a major stroke. Some of the signs are so subtle, brain scans will often mistake them for simple signs of aging. If silent stroke symptoms are left untreated, it'll lead to a major stroke. If you've had any of these symptoms at once, seek a medical professional. As I said, the sooner you seek medical treatment, the better chance you have. Have you ever undergone a brain scan or a medical scan of any kind? What was the process like? Was it uncomfortable? Sound off in the comments section and share your story with the Bestie community. Number 2, hospital treatments. Now, keep in mind, when I say treatment, there's no cure for a stroke. Doctors won't be able to just reverse the permanent brain damage. This is because the brain has gone for a significant amount of time without oxygen. Getting regular cardiac and vascular screenings can lower your chances of a major stroke. If you get to the hospital within 4.5 hours of a stroke, doctors can administer drugs to get rid of the blood clots and even extract the blood that caused it. Here's where the problem lies. About 25% of strokes occur during sleep. Because of this, it's difficult to tell exactly when the victim suffered the stroke to begin with. It could have happened around 9 or 10 hours before the discovery, making it too late for the blood clot treatment. Number 3, cognitive exercises. If you've experienced cognitive damage from a silent stroke, doctors might suggest that you practice small things to help your memory, at least the parts that can be restored. These steps include practice routines for various tasks you have throughout the day. These include things like chores, as well as necessary activities such as eating breakfast, lunch, and dinner. Not to mention bathing yourself and brushing your teeth. Of course, you'll only be taking part in these routines if doctors deem you fit to do so. Another useful exercise is to keep placing everyday items in their suitable spots. These include your house keys, wallet, and phone. This exercise will help you grow comfortable with an everyday routine once again and challenge your brain to remember crucial details. If it makes you feel better, you're also encouraged to write out a to-do list. You just have to make sure that you stick to the list. If you're having trouble memorizing numbers, you can set up direct payments of your bills so you don't have to remember the dates. But at some point, it would be good to try and remember important dates. These are all things that you can do from home. If you're outside of the house, you might want a friend or relative to assist you with your errands. You don't want to risk your well-being carrying heavy grocery bags, that is, if one is available. Before we continue, are you looking to get healthy? Maybe try and get your body in shape? Check out our recent video on what drinking a protein drink every day does to your body. Now back to our discussion on how to treat a silent stroke. Number 4, preventative measures. While there are several methods of treatment after a silent stroke, let's talk about something you can do to reduce your chances of getting one. We already touched on the importance of getting a regular checkup from the doctor. One of the things you can do health-wise is to maintain a steady blood pressure level. Studies have shown that high blood pressure will only raise your chances of suffering a silent stroke. This means that you should cut back on processed foods like sausage, bacon, and ham, not to mention items with too much sugar. Yes, soda and ketchup belong in this category. You'd also do yourself a favor by steering clear of all excess salt. Experts have shown that by cutting down on your salt intake, you'll lower your chances significantly. Another diet-related change you can make is watching your cholesterol. Your ideal level of good cholesterol should be 60 milligrams per deciliter, with your bad cholesterol being under 100. A silent stroke occurs when the blood supply to the brain is cut off from reaching a small area of your brain. This causes irreversible damage to your brain cells. By keeping tabs on your cholesterol and sugar intake, you maintain a healthy weight. This keeps your circulation going and allows oxygen to reach your brain with less obstruction. Let's talk about a preventative measure that needs its own subsection. Number 5. Quit smoking. If there's a history of strokes in your family, you're going to want to drop that awful smoking habit. Smoking cigarettes can make you twice as likely to die from a stroke. If you're smoking 20 in a day, you're 6 times more likely to have a stroke compared to someone who's smoke-free. 6 times! Smoking can make your blood thicken, narrowing your arteries and increases the chance of blood clots. This stops the blood from flowing properly, as well as the access to the oxygen through the blood. Tobacco smoke contains thousands of toxic chemicals. Once these chemicals reach your bloodstream, they damage your body's cells. This only increases the risk of a stroke. The chemicals in tobacco smoke can also make the platelets stick together. Your platelets being a certain type of blood cells. This brings you one step closer to a blood clot. Within 8 hours of cutting cigarettes, your oxygen levels will return to normal. Your carbon monoxide and nicotine levels will also reduce by more than 50%. Within 2 to 12 weeks, your circulation will gradually get better. By 9 months, your lung function will have improved by 10%. Number 6. Plenty of exercise. If you're already a non-smoker, one of the best ways you can prevent your chances of a silent stroke are by working out. Now, I don't simply mean lifting weights, I'm talking about some cardio as well. Did you know that exercising for 30 minutes for 5 days a week can reduce your risk of stroke by up to 40%? The best workouts for lowering your risk of a stroke are aerobic exercises. These help to work your cardiovascular system. They also improve your lungs and circulation. Aerobic exercises include walking, running, swimming, and cycling. Aerobic workouts can also include weightlifting, which will give you a burst of energy. If you feel like going for a simple walk, not only will you reduce your blood pressure, you'll also reduce the risk of heart disease, obesity, and diabetes. It's recommended that you walk 150 minutes per week, or around 30 minutes 5 days a week. Want a challenge? Try and work your way up to 10,000 steps a day. Start with the amount of steps you walk each day and increase it with each passing week. If you're at home and don't feel like going to the gym, buy a jump rope. Using a jump rope 15 to 25 minutes a day is terrific cardio. It can also improve your hand-to-foot coordination. Whatever exercise you choose, it'll definitely improve your chances of healthy living. This means less of a chance of a silent stroke. Have you ever suffered a stroke? Do you know somebody who has? Let us know in the comments below. We'd love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.